Welcome to Cancer Conversations with OHC. My name is Joni Monzo, and I'm excited this month to have Emma Shaffer with us. Emma is an advanced practice provider with OHC, specializing in gynecologic oncology. Welcome, Emma.
Thank you so much for having me. I'm happy to be here.
Thank you. So we are going to get started. We know that January is Cervical Cancer Awareness Month. And we are learning that the incidence of cervical cancer is increasing in women over the age of 30 and also in women over the age of 65. So I want to get down into learning more about, one, why do we think this is, and two, how can we arm women and empower them with the knowledge to hopefully reduce those numbers.
Yes, you're very much correct. Right now, we have a lot of great tools to detect cervical cancer. It's one of the greatest screening tools we have for cancer in general, the pap smear. And so we scan for precancerous lesions, and then we treat those who have precancerous spots. And we also have a vaccine, which there are not very many vaccines for cancer. It's just this and the Hep B vaccine are really the only ones that are known to reduce cancer risk. So I can't emphasize the importance of going to your primary gynecologist or your primary care provider and getting your routine pap smear and gynecologic exam. And so, yes, the question about the increasing rates in 30 to 34-year-olds, it's hard to know. Is it because the screening rates have declined among women in their 20s, or because HPV testing has become more effective in recent years? So it's a little bit more effective in testing those, and more women are coming back positive. To address the findings for women over 65, so this is a common issue, especially in my population of patients. I have a lot of patients that are over 65. The data suggests that the risk is so low in women over 65, so they stopped screening. However, this is for women that have no prior history of an abnormal pap smear, have no prior history of any abnormalities gynecologically. So it's a very small group of women who that really applies to. I think most women, if they're sexually active, have multiple partners, or if they are at an increased risk, they should continue to get regular pap smears based on the guidelines.
Okay, that's good information. What causes cervical cancer, and how does the vaccine work to help prevent it?
Yes, so it is caused by HPV. There are several strains that are known to be cancerous. 16 and 18 are the main ones that come to mind. And so it's similar to any other vaccine that you get for a viral illness. And basically it makes your body immune to specific strains. So there are 9 now in the most recent Gardasil vaccine that it prevents against. And those are the ones that are most likely to cause cervical cancer. Around 70% of cervical cancers are attributed to the high-risk strains 16 and 18. So it's a great tool. Like I said, there are not, if we had vaccines for every type of cancer, we would be would be a different world.
Yeah.
So yes, and it, like I said, it's similar to when you get a zoster vaccine for shingles, and it basically makes your body immune to it.
And when should individuals and or parents start considering arming their children, boys and girls, with the vaccine?
Yes, so because over 85% of people will get HPV in their lifetime, the recommendations are to start around 10 or 11 years old, considering getting the HPV vaccine. It's approved down to 9 years old. It's a very safe vaccine. It's a 3-part series, so you start with 0 months, and then it's 1 to 2 months, and then you do it again at 6 months, but very easily tolerated. Yeah.
And it can go up to age, because I remember
Yes.
when it was approved for older adults who perhaps missed the vaccine.
Yes. So now it's approved up to age 45, and I have a lot of patients with a history of HPV that didn't receive it when they were younger because it wasn't available. And there's actually evidence to show that it actually helps, even if you've already gotten HPV, it prevents other strains, and it can actually help with the viral load of the HPV that you already tested positive for. So it can help prevent dysplasia in the future, which dysplasia is, changes in the cell structure. And HPV affects, several different types of tissue. It's not just the cervix. It also affects the vulva and the vagina. So, that's why it's such a helpful vaccine to get, because it prevents, helps prevent all these different types of cancer that can affect you. Also, HPV causes penile cancer and anal cancer. So it's just good for everybody to get vaccinated.
Good information. And I think to let our viewers know that because it's such a common virus, if you have it, it doesn't automatically mean that you're carrying one of the strains that causes cancer.
Exactly.
However, it protects you.
Yes, exactly. And I also tell patients, even if they've tested positive for one specific strain of HPV, there's 9 that are covered in that vaccine, and some of those strains cause other symptoms like genital warts. So getting the vaccine can help prevent that as well. But yes, it's a very, very common problem, and I don't think enough people know about it. I don't think enough people realize. When I was growing up, I don't think I was told that 85% of people in their lifetime will get HPV. Your body clears it by a certain age, so that's why they don't do HPV co-testing on pap smears. So pap smear is basically a screening tool that we have as gynecologists, where we are scraping the cervix, with this little spatula type tool, and then we use what's called an endocervical brush, and we go into the endocervix, which is, if you look at a cervix, it kind of looks like a donut. So the middle of the donut is the endocervix, and we use that brush, and what it does is it gives us those superficial scrapings, and it lets us know, hey, are there changes here that are related to HPV or any sort of, cellular precancerous lesions. But yeah, we say when you are 25, you should start to get pap smears, and then, once you reach the age of 30, we want to do HPV testing with those pap smears, because evidence shows that a lot of people clear the virus prior to the age of 30.
Good information. So we talked about who's eligible, and how can someone be proactive and get the vaccine? Who should they contact? Who should they have the discussion with?
Yes, so the main person that they should talk to is either their family, provider, family care physician, primary care physician, or their primary gynecologist. It's very easy to get the vaccine. They can either administer it there in their office, or you can get it done by a pharmacist. You just give an order, and it's very, very easy to do.
Great. And I know that pediatricians obviously start those conversations as well.
Yes.
When children are younger, and as you said, it can start as early as 9.
Yes.
Good. I think we talked about the importance of screening, and I know here at OHC, and I think across the country during COVID, a lot of individuals did not get screening for obvious reasons, and so we want to remind our viewers it's important to get caught up on your yearly pap smear, your colonoscopy, your mammography. Let's go into signs and symptoms. So I'm getting my screening done yearly. I'm getting my yearly checkups. What should women be looking for, and when should they notify their healthcare provider?
Yes, so cervical cancer, unfortunately, sometimes the symptoms are not quite obvious. So you're looking for, your body better than anybody else, so looking for changes. The biggest thing is vaginal bleeding, either between periods or after intercourse. If you're having heavier menstrual bleeding, if you're having unusual vaginal discharge, and any sort of pelvic pain or back pain that's new and persistent, and pain during intercourse as well. So any symptoms like that, definitely letting your gynecologist know, so that they can, that might mean, hey, we're going to do a pap smear earlier than we were planning to, or we need to do a couple extra tests just to make sure that there's no signs of any sort of changes going on.
And I think it reemphasizes what you said earlier, because sometimes the symptoms aren't as obvious. We know that diagnosis earlier for any type of cancer provides the best outcome. So again, it's so important to get those yearly pap smears.
yes. And I said before, I said 25, but actually the screening guidelines for Pap smears, they start at 21. And at age 21, you're going to get a Pap smear every 3 years if it's normal. Obviously, if there's abnormalities, they're going to do it more frequently, and there's a whole algorithm that they use to figure out when that timing is. Then when you reach 30, that's when we start to do the HPV, we call it co-testing, but basically we're looking at the cells and we're also looking inside the cells to see is there HPV present. And then if those are negative, if they're all normal tests, then it's every 5 years. Again, based on whatever the findings are. And then 65 and older, I touched on this before, it is very dependent on your history. So if you have a history of abnormal Pap smears within the past 25 years, that actually you should still be getting regular Pap smears even over the age of 65. And then also, even if you had a hysterectomy, if you've had an abnormal Pap smear within the last 25 years, still need to be getting Pap smears because, as we talked about, HPV affects vaginal tissue as well. So, yes, it causes cervical cancer, but even when the cervix is taken out with a hysterectomy, you can start to have changes in the vaginal canal. So it's doing the same thing it would be doing on the cervix, just to make sure there's nothing going on, with any sort of precancerous changes.
Great information. Are there risk factors or lifestyle changes that we should be aware of as it relates to cervical cancer?
The biggest risk factor is going to be, becoming sexually active at an early age or having multiple sexual partners, unprotected sex, history of other STIs, so sexually transmitted infections, having a weakened immune system. So as I talked about, 85% of people are going to get HPV in their lifetime, but if you have a strong immune system, you're able to fight it off more easily. But if you have a history of a transplant, if you're on immunosuppressive medications, those all can be factors. Also, smoking is a huge factor. So I see, patients that get aggressive cervical cancers, and sometimes, they have a history of that, a pack or 2 pack a day smoking history. So I always try to encourage cessation because it's really going to make a big difference. And I have noticed in patients that are able to quit, that they do, have less changes and less precancerous spots that are found. So definitely trying to quit smoking is a big thing.
Good information. I know that we had asked a couple viewers for some questions, so I want to get to those.
Yeah.
One was, I'm 35, married, and do not intend to have any more sexual partners in my lifetime. I was not given the vaccine when I was younger. Should I request it now?
Honestly, it's a very safe vaccine and it's very well tolerated. So I say if you have questions and you are willing to get it, I do not think it's a bad idea. I actually encourage you to get it. Even if you have, one partner, as we all know, life is unpredictable and it's really just preventing and helping yourself. And you may even have HPV and not be aware of it, again. So like I talked about before, there's evidence that suggests that having the HPV vaccine, even with a prior history of having HPV, can help to prevent those cellular changes. Also, again, it's a safe, well-tolerated vaccine. If you have any questions about the safety of it, you can always ask your provider, but you can just get it at your local pharmacy. It's very quick.
And I think you bring up a good point because the virus can lay dormant.
It can.
And I think that we have seen this with some of our patients with head and neck cancer, that it's caused by HPV. And
yes.
So the more people that become vaccinated, again, women and men, hopefully we'll see a decrease with that as well.
Exactly. I mean, it's the same as when we had a vaccine for smallpox and then we eradicated it. It's, if we can have more people vaccinated, more people in general are going to be protected. Safe sex is also, I always encourage that, using condoms, but at the end of the day, your biggest tool is going to be getting that HPV vaccine.
We do have, and I believe that you answered this question, but we had a question from someone that said, why do Pap smear screenings stop for women over 65? Would you recommend it? And I think that you would answer that as well.
Yes, I definitely, there's other conditions also that put you at an increased risk even after 65. there was a medication used for women in pregnancy called DES. And so women who are now adults in their 50s, 60s, that were exposed to that medication while they were in their mom's belly, they are at an increased risk for cervical and vaginal cancer. So, getting regular pap smears when you have that history of the DES exposure is always recommended. Also, again, if you're becoming sexually active, even after 65, I think, again, you should be doing safe sex practices and also getting vaccinated just to protect yourself. That's the trouble, though, I will say. Over 65 is not covered to get vaccinated, unfortunately. So getting the regular pap smears is really going to be your biggest tool, and getting regular gynecologic exams. I know women say, well, I'm not going to get pregnant, I'm over 65. That's not why we have you use condoms. It's really just to prevent, that risk of cancer.
Great information. Well, I know you work closely with Dr. Jikubi and Dr. Marcia Bowling, and they have been on our live Facebook many times and share your same recommendations. This has been great. Thank you so much for your help. I appreciate it.
Thank you for having me.
Yeah. If you would like to learn more about cervical cancer, or you would like a second opinion at OHC, please visit ohcare.com or call us at 888-649-4800, and we also have a wonderful tool on our website that outlines all of the screening guidelines. So please go to our website and look for that, and it's easily downloadable. So thank you for your time. We appreciate it. This has been really